The epic coronavirus is dashing toward an impact with two longer-running pandemics, as floods of HIV and tuberculosis diseases have left a huge number of individuals in the creating scene especially powerless against the new danger. The areas hit hardest by HIV and tuberculosis are in Africa and South Asia, where the coronavirus is spreading quickly. The nations most in danger incorporate South Africa, home to the world's biggest number of HIV-constructive individuals, and India, which has the most elevated number of tuberculosis cases on the planet. HIV and tuberculosis are available wherever around the world. Tuberculosis has spread in repeating pandemics for many years, executing at its top in the 19th century an expected quarter of Europe's populace. More than 1 million despite everything bite the dust of tuberculosis every year. HIV arrived at pandemic stage during the 1980s and has slaughtered in any event 32 million individuals. Around 40 million individuals presently live with HIV. Specialists expect COVID-19, the infection brought about by the coronavirus, to influence bearers of HIV and tuberculosis excessively, and outskirt terminations and swarmed medical clinics may make getting treatment harder. South Africa is a synchronous focal point of each of the three pandemics. The nation is home to 20% of the world's tuberculosis cases just as 20% of the world's HIV-constructive populace about 8 million individuals and has the biggest affirmed COVID-19 include in Africa, at more than 1,700. We are planning for the most noticeably terrible, said Salim Abdul Karim, a South African irresistible ailment pro who is on the nation's presidential coronavirus team. That defenselessness has prodded the administration there to make snappier, and that's only the tip of the iceberg uncommon move in endeavoring to slow the spread of the coronavirus. It has likewise implied that HIV and tuberculosis specialists are all around spoke to on the nation's coronavirus team. At the point when you take a gander at the information from Wuhan, the most noticeably terrible influenced were over 70 years of age, Karim said. We are getting ready for a situation where it seems to be comparative in HIV and tuberculosis patients a demise rate in the locale of 10%. COVID-19 hasn't been around long enough for decisive examinations to be finished on its relationship with invulnerable clutters, however the dangers are promptly clear. Tuberculosis is principally a respiratory malady, as coronavirus, which implies that the individuals who experience the ill effects of it regularly have seriously decreased lung well-being. Furthermore, HIV causes a dynamic disappointment of the safe framework, leaving transporters increasingly powerless to death from different diseases. A few specialists dread that passings from tuberculosis in India could twofold in the following year or two. Effectively, in excess of 1,000 Indians bite the dust of tuberculosis consistently. For tuberculosis survivors like Deepti Chevan, 37, COVID-19 is an unnerving possibility. She was restored of a multi-medicate safe strain of tuberculosis in 2005, however lost one of her lungs. Her staying right lung is desolated by a kind of organism. She has burned through the vast majority of the most recent month detached in the one-room loft she imparts to her folks in Mumbai. She remains in the room, and her folks eat and rest in the parlor. On the off chance that the coronavirus is ending the lives of ordinary solid individuals with two lungs, I don't think we get any opportunity of enduring, she said. Her solitary alternative is to separate herself until the pandemic is finished. I won't have the option to come out much after the administration says it's protected to wander out, she said. Specialists are basing a portion of their suppositions about how COVID-19 will cooperate with HIV and tuberculosis on considers that interface them with flu, regardless of whether the correlation is vague. The coronavirus has demonstrated to be deadlier than the normal influenza, particularly among the older, and the working supposition of most specialists is that it will likewise greatly affect immunocompromised populaces. Demonstrating contemplates recommend more influenza and then some extreme influenza in tuberculosis patients than in somebody who is sound. What's more, now and again, influenza can trigger dynamic tuberculosis in idle tuberculosis cases. This season's flu virus can go about as a stressor, and a trigger, said Nesri Padayachi, who has examined tuberculosis in South Africa for a long time. In excess of 2 billion individuals around the globe convey an inert type of tuberculosis. In any case, regardless of whether specialists' most noticeably terrible feelings of dread about the connection of the sicknesses aren't valid, cracks in pharmaceutical stock binds because of fringe terminations, just as the preoccupation of nearby clinical assets from HIV and tuberculosis treatment could in any case risk a large number of lives. The inadvertent blowback of this will be huge, said Madhukar Pai, a disease transmission expert who heads the McGill Global TB community in Canada. On the off chance that COVID-19 spreads generally in lower pay nations, all the additions made against tuberculosis as of late will be disentangled, he said. Beginning reports from China and South Korea show that the coronavirus has disturbed consideration for tuberculosis patients in those nations, said Pai. Clinical workforce are being redirected to in general individuals contaminated with the coronavirus, and wards for patients experiencing drug-safe tuberculosis have been repurposed to fill in as coronavirus disengagement wards. Nations with less fortunate well-being frameworks in Eastern and Southern Africa that, in contrast to India, don't have pharmaceutical ventures are likewise confronting the possibility of coming up short on drugs. Kenya's fringes have been shut for a considerable length of time, and the stockpile of antiretroviral drugs is unsure. In the same way as other African nations, Kenya limits clients of antiretroviral medications to 1-month solutions on account of constrained inventory. Presently, the groups that assemble at facilities consistently to gather the medications are perfect areas for the coronavirus to spread. Specialists are especially stressed over nations like Kenya. However, obviously, consideration has been focused on South Africa, which keeps on enduring the worst part of both the HIV and TB pandemics. The nation is amidst a 3-week lockdown, and 10,000 well-being laborers are going way to entryway the nation over to test individuals, just as to find where individuals with HIV and tuberculosis are living. That challenge is aggravated by an expected 2 million South Africans who have HIV however are undiscovered, and an enormous number of others who are believed to be taking their antiretroviral medicates conflictingly, which can leave the resistant framework progressively powerless. We're quickly setting up a focal information vault that will house all key data, for example, individuals' HIV status, for instance, just as other clinical records, said Ian Sun, another individual from South Africa's coronavirus team, who is structuring intercessions in conference with President Cyril Ramaphosa. That information can be joined with related development information. Since this is esteemed a national security issue, we can utilize individual cell phone information to a limited degree to screen developments, as well. The information will be utilized to recognize areas where problem areas are probably going to happen or are happening as of now and where to fabricate field treatment focuses, said Sun. India is likewise in the center of a 3-week lockdown, remembering a boycott for almost all open transportation. More than 1.3 billion individuals have been approached to remain in their homes but to purchase nourishment or medication. That has prodded a departure of laborers who are leaving urban communities by walking after their employments vanished and they confronted a battle for endurance. While India and South Africa have generally vigorous clinical frameworks contrasted and those of other creating nations, the lockdowns have left millions with HIV and tuberculosis dubious of how they will get to the medications important to deal with their ceaseless conditions. The lockdowns as a result push an unbalanced effect of the coronavirus onto more unfortunate and more ailing individuals. Guaranteeing congruity of treatment for the effectively wiped out is at the highest point of our motivation, said Michelle Yao, the World Wellbeing Association's Crisis Activities Administrator in Africa. He focused on that in the creating scene, it isn't simply HIV and tuberculosis that administrations should stress over, yet jungle fever, which influences in excess of 200 million individuals every year, generally in Africa, and ailing health, which influences almost 1 billion. General well-being activists are asking quick activity by governments over the creating scene to guarantee that HIV and tuberculosis patients don't lose access to treatment. Kenya, regardless of having recorded distinctly around 170 affirmed COVID-19 cases, is probably going to force a lockdown in the coming days, and the nation's well-being service has just started unequivocally encouraging individuals not to leave their homes. In any case, the direction on 1-month antiretroviral remedies stays set up. On the off chance that a lockdown comes to Kenya, a total one, we just don't have the foggiest idea whether there are sufficient antiretroviral drugs in the nation to treat our HIV-constructive individuals, or what technique the administration needs to get them, said Nelson Otwuma, who coordinates a charitable that advocates for individuals with HIV in Kenya. HIV-constructive individuals here are progressively frightened they won't get treatment, or won't be allowed into the emergency clinic, than of getting this new ailment.